San Mateo County Health System is making some important changes in the way it stores and shares patient data among its clinics and divisions. This change is called SMC Connected Care Health Information Exchange. By the end of this video, the viewer will have met the following educational objectives. Understand the basic structure and function of SMC Connected Care as it applies to your workflow. Define the benefits of SMC Connected Care. Explain the advantages of role-based access and mitigation of security issues, and an understanding of the types of information found in SMC Connected Care. SMC Connected Care is a health information exchange, or HIE, used by San Mateo County Health System. HIE is a technology solution that provides the capability to electronically share clinical information. This information can be shared among internal and external healthcare information systems, such as electronic medical records, or EMRs. With HIEs, sharing information among EMRs maintains the medical meaning and integrity of the information being exchanged. It is difficult to access comprehensive health information for each patient and client in San Mateo County Health System's current state. We know that it is normal for patients and clients to receive care across divisions in the health system. Given that most divisions have their own EMR, providers and staff may not have access to each EMR where their patient's information is recorded. This makes it difficult for providers and staff to get a comprehensive picture of all relevant patient and client health information. This access and functionality issue creates a time-consuming barrier to care for patients since critical information about medications, labs, and services may not be readily available to the provider. This barrier also applies to our patients and clients who receive care by our community partners, such as Stanford Medical Center, Ravenswood Family Health Center, Sutter Health System, and others. As mentioned, a patient or client may receive services from multiple divisions within the health system. With that said, there's currently no accurate way for providers to gain a complete view of all of the patient's health information. As a result, social and behavioral determinants of health may be documented by one provider but may not be available to another. When this is the case, issues such as chronic conditions, behavioral health issues, and homelessness may not be known. This can negatively impact the ability of the patient's care team to provide a comprehensive approach to address these issues. Consequently, without tools like SMC Connected Care, patients' and clients' health care can be fragmented when health information existing in multiple EMRs is not accessible to the appropriate healthcare providers. Now we know where we've been. So, where do we want to be? SMC Connected Care delivers all relevant patient and client health information into one source, regardless of its primary origin or the EMR system it came from. According to the HIPAA Minimum Necessary Rule, providers and staff have access to all relevant patient and client health information from health system services. Access to relevant information also applies to healthcare provided by our community partners. This comprehensive solution to accessing health information can reduce service and testing redundancies, facilitate safer decision-making related to medication management, improve care coordination and communication between providers, and enhance secure sharing of patient and client information. Through SMC Connected Care, authorized providers and staff will have access to a myriad of patient and client information. Information will include, but is not limited to, demographics, including name, birth date, sex, primary language, insurance information, and emergency contact, scanned documents such as advance directives, post, and durable power of attorney, clinical information, including immunizations, medication list, problem list, allergies and adverse reactions, laboratory test results, primary care provider, care team members, treatment plan or plan of care, clinical imaging reporting such as X-rays, CT, and MRIs, and cardiology results such as echo, EKG, and other results, reports including operative reports, consultation report, history and physical, hospital discharge summaries, ED physician assessment, and procedural reports such as ERCPs and others. Information about encounters or healthcare visit history to clinics, emergency rooms, and hospitals will also be available. This may include visit dates, diagnosis, and healthcare provider information. And finally, social history information, including homeless status, guardian and contact information, and incarceration history. SMC Connected Care users will be able to view health information in a single place, even if the information originates from multiple EMR systems. This technology works by pulling patient and client data from EMRs and compiling that information into one system. Patient information viewed in SMC Connected Care cannot be edited, downloaded, or printed. In addition, no new user ID or password will be needed to log into SMC Connected Care. You will have access through your network login. SMC Connected Care will pull information about patients and clients from the following EMR and information systems: ECW, PISIS, Sorian, Envision, Q, and Avatar, including both versions used by BHRS and FHS. The following health system divisions will be able to view this information: Aging and Adult Services, Behavioral Health and Recovery Services, Correctional Health, Emergency Medical Services, Family Health Services, Public Health Policy and Planning, and San Mateo County Medical Center, including hospital, clinics, and emergency department. Patient and client privacy is very important to San Mateo County Health System. SMC Connected Care utilizes the highest technology security available in the industry today to protect patient information. The ability to view patient and client information in SMC Connected Care is determined by role-based access. In order to comply with HIPAA minimum necessary rule, access is granted based on providing the minimum necessary information to perform each role. That is, you will only see information that is appropriate and relevant to your job function. SMC Connected Care includes a Break the Glass feature, which serves as an additional layer of protection for sensitive information. Referencing the HIPAA minimum necessary rule, only providers and staff who have roles which require knowledge of sensitive information will be granted access to Break the Glass. The following are examples of information that will only be accessible via Break the Glass: alcohol and drug program information, VIP patient status, and information about patients and clients who have opted out of participating in SMC Connected Care, except in an emergency situation. Patient and client health information is encrypted into a type of technical language that can only be translated or decrypted by someone who has the authority to do so. Therefore, only authorized care team providers will be able to read patient information. Every time you access a patient or client's health information, an audit trail records information, including, but not limited to, username, patient viewed, date, and time. This type of accountability provides an additional layer of security for patient health information. There are multiple ways that SMC Connected Care benefits providers and staff along with patients and clients. These benefits include the following: improved patient safety by reducing medication and medical errors, increased efficiency by eliminating unnecessary paperwork and handling, improved coordination of care for the patients and better communication between providers, elimination of redundant or unnecessary testing, improved public health reporting and monitoring, and enhanced security of information by eliminating the use of paper-based files, faxes, phone, and mail. By viewing this video in its entirety, you have met the following educational objectives: understanding of the basic structure and function of SMC Connected Care as it applies to your workflow, knowledge of the benefits of SMC Connected Care, description of privacy and security measures including role-based access and Break the Glass, and a summary of the types of information provided by SMC Connected Care.